All right. Good evening. Good evening. Good evening, Ditto.
Evening. Evening,
How are you?
everyone.
Good evening, everyone, and welcome to our Tuesdays with Dr. Joel Lopez. And we changed our time slot, no, Dito. We
Yes, we
changed it
did. Yeah,
7
to so we're doing seven from now on, no? So,
Oo.
is it from now
Uh,
on?
yeah, 7 from now on to accommodate the schedule of Dr. Lo also. At the same
Yeah.
time, we're continuing with a series of different diseases. So
Right.
tonight we're talking about hypertension.
Yes,
Ikaw
hypertension.
expert yan. Ikaw expert, di ba?
Ikaw ba nagkaroon ka na, Anton?
Wala pa. But my mom has hypertension eh. So, I
Yeah.
wanted to know nga whether it's hereditary ba yan or namamana ba yan or paano ba yung hypertension na yan. Or as you grow older, do you get that, di ba? So, parang it's one of those dreaded disease eh.
Yeah. In my case, kasi I've had it since I was 21. So I think I've been on medication and maintenance for 21 before I actually lost the weight and I started following the regimen that was given to me by my wellness doctor. It's Dr. Joel Lopez nga. And of course, I did a 28-day detox, which was very helpful in my recovery out of that. So now I only have like a couple of medications, but it's more of for like supplementation, yeah. Supplementation to maintain. But I'm off of the meds, so
Okay. Yeah,
yeah.
so I'm so excited about this topic. If you guys are watching in the live stream tonight, or watching the replay, please put your questions in the comments. Dr. JLo will answer all of them. And also towards the end of the show, Dito, we'll announce the winner of the glucose meter.
So
And are we giving away one tonight also, Dito?
yes, we are. We are giving away tonight also. So, ano ba yung ano natin, Anton? We'll ask for them to send letters out, right? Why they
Yeah.
need the kilometer, and then we'll choose from the selection of letters or emails that were sent to you.
Yeah.
But I know that we've already chosen one from our first show. So,
Yes.
and
And
we'll announce it at the end of the show, right?
yeah, we'll announce that towards the end of the show. All right.
Uh, okay.
Without much further ado, let's start.
All right.
All right.
Good
Good
evening,
evening,
guys.
Dr.
So,
Jane.
uh,
Good evening, everyone.
Good
evening.
evening. All right. So we're excited. How we'll do this is we'll start off with the hypertension presentation, quick presentation, but we wanted this to be more Q&A, no, Dito?
Yeah, that's right.
Hmm.
All right. All right. Let's start. Doc
Okay.
Chilo.
Yeah, so before anything else, hypertension is defined as a blood pressure that's at least 140 over 90. There's also pre-hypertension, like 130 over 90 or 85. So, but those are just numbers. We're not really treating the numbers. And before I proceed I just would like to tell everybody that hypertension is not a disease. It's actually a symptom. It's a symptom of an underlying problem. In regular medicine or conventional medicine, it's been subdivided into primary and secondary hypertension. So when you say primary or essential or idiopathic hypertension, basically it just says that the actual cause is unknown, but there are a lot of contributory factors to it. Whereas secondary hypertension could be due to underlying problems or secondary to other conditions like, for instance, heart disease, renal disease, or adrenal diseases like pheochromocytoma, in which the tumor produces catecholamines causing high blood pressure. So hypertension, like I said, is a symptom. So usually it's being treated with antihypertensive drugs. But the thing is, once you get off of these antihypertensive drugs, is that your blood pressure shoots up. The reason for this is because you're not really treating the underlying problems. And there are a lot of underlying problems. And I would like to basically discuss those. So typically the approach again to hypertension is the use of meds, including water pills or like thiazide diuretics. Then there are other medications like beta blockers, calcium channel blockers, angiotensin receptor blockers, and so on and so forth. But so they're just treating basically your blood pressure. Once you get off of it, tataas ulit because again the underlying problems is not being treated. So there are a lot of possible causes of high blood pressure and or contributory factors rather, and they include number one, obesity. So when you have extra body fat, what happens is that your body tries to push blood against the circulation. I'm sorry. Can you hear the kid crying? Hello? Are you guys there? Hold on a second, please. Hello?
Yeah, we're here.
Break. Hold on.
Okay, sige.
Oh, okay.
Gusto niya sumama. Gusto
Yeah.
niya sumama.
Okay. Yeah, sorry. We have a guest for tonight. Oh, there's Ethan. Don't cry. Look, I'm talking to someone. There's Uncle Ditto. There's Uncle Anton. Say hi to them. Come on, say hi.
Hello.
Say hi to them. And here's
Anak ni Doc.
May break tayo. Intermission. Okay. So, yeah, as I was saying, we need to treat the underlying causes so that the blood pressure would actually improve eventually. Yeah, so among these causes include heavy metal toxicity. So heavy metals like lead and mercury could actually cause high blood pressure. So the typical treatment for this is called chelation therapy. So I think we may have discussed this before, but chelation therapy is the treatment of heavy metal toxicity in which you use certain amino acids like EDTA. That's done intravenously or through the use of suppository. But other things could actually chelate the body of these heavy metals. And these heavy metals include, I'm sorry, I got lost my train of thought. Couldn't go back in there. Okay, yeah, so there are other things that you could use to chelate these heavy metals. They include foods like garlic, cilantro, and onions, and certain seaweeds or algae like chlorella or spirulina. So these are things that people could use to help get rid of these heavy metals. Once you get rid of these heavy metals, the blood pressure would actually improve, and there would be no need to take medications. So other possible causes of hypertension. Other causes of hypertension include nutritional deficiencies. So these nutritional deficiencies include potassium and magnesium. So people who are deficient in these could actually have high blood pressure. Normally, you find this in green leafy vegetables or in a plant-based diet. However, if you're eating a lot of animal products, or if you're eating a lot of inflammatory foods, like let's say deep fried foods, like crispy pata and all that, what happens is that your body would have high blood pressure. So it's really important to have more of a plant-based diet, as well as take certain nutrients such as potassium and magnesium. Yeah, so Other causes could include like hormonal imbalances. So if a person has hormonal imbalance, that could also cause high blood pressure. So it's really important to balance your hormones. Otherwise, your blood pressure could shoot up. We see this in cases of stress, acute or chronic stress, in which there's production of catecholamines and and hormones like cortisol, respectively. So it's important that when you're under stress, you do certain things to actually lower your stress, and this may include things like let's say deep breathing exercises, getting massages. Some people. So yeah, I did mention massages, deep breathing exercises, taking certain what we call adaptogens like rhodiola, ashwagandha, ginseng, and DGL or licorice. However, with licorice, even though it's an adaptogen, it may eventually cause high blood pressure with prolonged use. Okay, so there are other things that could also cause high blood pressure. These are iatrogenic forms of high blood pressure. So these are, for instance, drugs like epinephrine or ephedra. These are popular weight loss products that could eventually cause high blood pressure. So it's important to look at a person's list of medications when they come to see you for high blood pressure.
So,
Um,
Doc,
yeah,
question.
yeah.
So, what you're saying, this is really caused by diet, predominantly, and maybe stress and toxins, no? Tama
Yeah,
ba?
a lot of these issues are caused by environmental causes or dietary and lifestyle causes. So there's this field of medicine called epigenetics. So we may have the risk or the genes to actually develop hypertension, but if we have good lifestyle or diet, we don't express them. Only when you, let's say, go on a like a let's say an inflammatory diet, or if you have a lifestyle like a stressful lifestyle, that's when people may actually express the gene that could cause high blood pressure. Yeah, so these are just a few of the things that could cause it.
Okay.
Yeah, so you see that also in diabetes. People who have high salt intake, so people who are salt sensitive, they're the ones who are more prone to develop high blood pressure. And of course, I did mention about stress. Aging does that too, because when you age, you actually have more hardening of the arteries. So when you do have hardening of the arteries, it could actually cause your blood pressure to go up. And then I did mention low levels of potassium primarily, as well as magnesium. Then lack of physical activity. So having a sedentary lifestyle would actually cause your blood pressure to go up. And then there's, of course, heavy alcohol use that could actually contribute to that as well. So in this diagram, it tells you nutritional ways to actually lower your blood pressure. So there's a lot of options, if you can see here. So vitamins A, B2, B6, C, D, E, coenzyme Q10, lipoic acid, cysteine, oleic acid, carnitine, folate, calcium, magnesium, copper, zinc, glutathione, and biotin. All these things could actually help reduce your blood pressure. So the best thing to do, ideally, if you have the means to do it, is to do a functional intracellular analysis or nutritional panel to find out what you're deficient in. Because again, if you just correct these deficiencies, your blood pressure should actually improve. So we could go over each of them, beginning with vitamin A. So this is how it actually works. So vitamin A suppresses the growth of vascular smooth muscle, thus keeping the blood vessels clear and wide. So vitamin A, you could just find that in your multivitamin, but you could also get it in yellow. Ethan, no, don't. Okay.
No.
Yeah. So yeah, as I was saying, vitamin A, you could get it from yellow, orange mga veggies. So that includes like carrots and pumpkins and papaya and among others. So there's also vitamin B2. Again, it's one thing that would work on the anti-HFR gene. So once you lower this inflammatory factor called homocysteine, that could also lower your blood pressure. Vitamin B6 also does the same thing by lowering your homocysteine. Then vitamin C improves your blood vessels to react appropriately to relaxation signals. So vitamin C has a lot of benefits. It's also a what do you call this? It's a precursor to the collagen molecule. So that would make your arteries more what we call pliable instead of stiff. Vitamin D is also necessary for calcium transport. So it actually would help lower blood pressure by acting like a calcium channel blocker. You guys have heard of nitric oxide, right?
Yeah.
Yeah, so it's something that could actually lower blood pressure, and the vitamin E would actually do that by increasing your nitric oxide synthase.
Mhm.
CoQ10 is also one common nutrient that we give for high blood pressure. It's important in the production of energy in your mitochondria. Lipoic acid is an antioxidant too. Works by mimicking calcium channel blockers. Oh, sorry. Ethan, quiet. Excuse me, guys. Can you take a short break?
Okay.
So,
You,
All right.
Ditto could talk
muna
for a
tayo.
bit.
Yes.
Okay.
Okay.
Yeah. So, while si Dr. Joel is pacifying the kids, yung underlying causes importante. No? I think we should discuss it again. Yung about obesity and heavy metal toxicities. Actually, I think lahat yan I had those underlying causes. First of all, I was obese. I was I think mga 50 pounds overweight, and metal toxicities. I had that also, and see Dr. Joel was able to chelate me. So I went to his clinic, and then I underwent chelation. But more or less sinasabi niya, the natural way of chelating your body is through garlic and spirulina and yung mga plant-based diets. And I'm lucky to have sources of that now kasi that's one thing that I don't run out of yung mga chlorella and then yung spirulina and then yung mga sinabi niya na ashwagandha. And so everything now is actually, some of them are found in the 28-day detox that we did, Anton. So it's all there. Even the potassium and the magnesium, yung mga deficiencies, and ano ba yung sabi niya, chronic stress. When you have chronic stress, we have to have like breathing exercises. Siyempre, kasi parang palagi tayo nauubusan ng hininga niyan when we're undergoing chronic stress. And then
So,
he mentioned about, yeah, go ahead.
Meron ka ba ring hypertension or wala?
Alam mo, wala na akong hypertension, awan ng Diyos, no? Ang BP ko ngayon is 120/80. On a hot day siguro, it would more or less go up to about 130/80. But it's controlled over parang 180/75, 120/80 na siya ngayon. And it's because of all the lifestyle changes, modification. And I think na-mention ni Joel na uh, we actually have the gene to develop this kind of illness, but then it's really up to us to change our lifestyle. So those are the things that we need to understand, because if we modify our lifestyle, that can actually change the way that the way that we are going to live moving forward. So
Mm.
yun. Yep.
Okay. So, Doc, are you ready? Let's see. Ready na si Doc.
Yeah, give me a minute.
Okay. 1 more minute. Nag-ready siya. So, lahat yung mga vitamins na yun, tinitake mo ba? Yung CoQ10.
Yeah, CoQ10, I take that also. I take
Okay.
CoQ10. Of course, vitamin A in fruits and veggies. Vitamin 2, vitamin B2, B6, those are found in the juices that we take.
Mm.
Vitamin C, collagen, no?
Sa lean greens, meron ba yan?
Sa lean greens, lahat ng plant-based na mention ni Dr. Joel, it's there. And of course, I think we should also ask him about pH, no, and how that's important, because after when this started, when COVID started, he
Mhm.
actually asked me to stop with my ACE inhibitors. So it's only lately that I stopped with my medication. So yung mga ACE inhibitors ko, actually, it makes you prone to COVID. If you take that, there was this. I let him explain it. I don't want to explain it because it's more of a, he knows why he made me stop on my medication.
Okay.
So,
Yeah.
here we go. Doc,
Ready? Are you
welcome
done?
back.
Yeah, ready. So sorry, guys, about that. I was babysitting my friends' kids. So anyhow, yeah, other things that would actually contribute to hypertension is a lack of oleic acid. So this is something that you get from olive oil. So this oleic acid has anti-inflammatory benefits. So that's how it actually lowers your blood pressure. L-carnitine, it's quite commonly found in certain drinks, but you're actually not getting enough of it in those drinks. And so this carnitine is typically found in meat products. So those who avoid meat typically are deficient in these. But it has to be at least grass-fed meat. Um,
Mhm.
yeah, so that's how L-carnitine works, basically acting similar to an ACE inhibitor, which is a type of an antihypertensive drug. So at least it has less side effects, and it's also a fat burner, besides being something that would lower your blood pressure. Folic acid also lowers your homocysteine, and that's
Mhm.
how it actually lowers your blood pressure. Calcium also does the same thing by reducing what we call vasoconstriction, or narrowing of the arteries. Magnesium is something that actually relaxes your blood vessels. So that's how it actually works. And a lot of people are actually deficient in magnesium. It's typically found in green leafy vegetables. And those who have low magnesium would have not just hypertension, but everything actually stiffens or constricts. So it's actually a contributor to conditions like asthma and fibromyalgia and even depression. Copper is also something that would also cause hypertension. Um, Zinc is also another nutrient that regulates angiotensin and endothelin. These are enzymes that actually affect your blood pressure. So it's important to make sure that you're also having optimal levels of zinc. Then too much oxidative stress, or when you have a lot of free radicals, that could also cause hypertension. So one of the most powerful endogenous antioxidants in the body is glutathione, which is actually produced in our liver primarily. Then biotin finally is one of the nutritional approaches to high blood pressure. It actually reduces blood pressure by activating an enzyme that causes your smooth muscles to relax. So there's so many options for those who are looking for nutritional or natural ways to actually lower their blood pressure. There are also herbal medications like uh, there are also herbal medications that would lower your blood pressure, like garlic, for instance. So garlic is something that is easily available, and people could actually incorporate it easily in their diet. Yeah, so those are among the things that could actually help with your blood pressure. And by the way, dehydration also may raise your blood pressure. So
Mm,
it's important to really have enough water intake. Again, the approach is a dietary or lifestyle changes, because they typically would work in reversing high blood pressure.
okay.
So
So, Doc, you can really treat the symptom. Ganun ba yun?
symptoms, you could treat it easily with, let's say, medications. But again, if you get off of the medications, your blood pressure would
Mm,
usually shoot up because you're not treating the underlying causes.
so you
So
need to treat it. Okay.
yeah, it's really important to find out the underlying cause. So, because if you do it that way, your blood pressure should improve, and you don't have to take medications indefinitely. Because the problem with medications sometimes is that it may cause side effects, and when you get side effects, typically doctors would give another medication to treat that side effect.
Okay.
Yeah.
And
So Doc,
for those asking, so the first step is really to do a nutrition panel. That's how
Yeah,
you would.
ideally get a nutrition panel.
Okay.
But let's say if your blood pressure is not so high, then you could actually start with nutritional approaches. I would only recommend medications if your blood pressure is really high, or or if it's causing end organ problems already. And let me find that slide. So if you have end organ damage, that's when you need to be on medications to immediately lower the blood pressure. But long term, you still really need to address the underlying cause. Otherwise, these medications that you took acutely for, let's say, emergency, would cause side effects eventually.
Okay. Dito, you have a question, Dito?
yeah, so Doc, I have a question. I'm just going back to what you said about people who actually need what is that L-carnitine in their bodies. Like for me, for instance, no, I'm trying to veer away from meat products. So yung um, being on a plant-based diet isn't good for you for me. You were saying, no, Doc? Oops, we lost him. You're on mute. But
Okay. What were you asking again, Dito? We'll wait
yeah,
for
so
him.
no, I was asking about kasi I plan to go totally plant-based, but I remember him
Talaga, ha?
saying
Talaga,
if
ha?
your blood type is O, then you need to have to be on meat products. For me, kasi I'm B positive. Doc, I remember. Okay, just going back to my question about what you said about people being on L-carnitine, which is only
Hmm.
found in meat products.
Yeah.
If I plan to go totally plant-based, I remember you saying before that if your blood pressure blood type is O, is that
Hmm.
right? You have to be
Yes.
on a you have to be on L-carnitine. But in my case,
Yeah.
my blood type is B positive. Can I totally go plant-based?
Yes, you may. Yes, you may. But
Okay.
it's important that you get enough protein. Otherwise, you would suffer from sarcopenia or muscle loss.
Right. So, Doc,
Yeah. So make sure you
yung
get
other
enough
source,
protein and do exercise still.
right? So yung yung protein shakes that we take, the one with the grass-fed cow source with
Yeah.
whey, is that a good
Hmm.
source of L-carnitine as well?
Yeah, there's some L-carnitine there, but not probably not enough. You may have to
Okay.
take extra L-carnitine, especially if you do have high blood pressure.
Okay.
Yeah.
But now that my blood pressure is controlled, can I at least or how do you measure that?
But you're not taking medications anymore, right?
No, I don't. I'm not taking medications anymore.
Okay, good, good. Yeah,
Yeah, yeah.
so your maintenance would be like, for instance, omega-3 fatty acids, which is an anti-inflammatory, taking magnesium, which is a muscle relaxant. Potassium also is a good mineral to take for high blood pressure. And if you do have high levels of heavy metals, it'd be good to do chelation therapy, either IV or through the use of certain foods um, for maintenance, like the garlic, cilantro, onions, or chlorella, and something called zeolites. So these are things that would get rid of heavy metals from our body.
Yeah. So, Doc, you mentioned ashwagandha.
Mhm.
What is that for again? Which underlying cause?
Yeah, stress could actually cause elevation of your catecholamines, which could actually raise your blood pressure. So these adaptogens would actually make your body respond better to stress. So that would include the ashwagandha and rhodiola and ginseng. Those are the most common adaptogens that's being prescribed by naturopathic MD.
Okay, and then I remember one of my doctors saying that you mentioned kasi that hydration is important when you have high blood pressure. No?
Mhm.
Is there such a thing as being overhydrated?
Yeah, there's a condition in which you could have too much fluids in your system,
And will that
and like
cause high blood pressure as well?
yeah, it could do that too. Like typically, people who have too much fluid in their bodies are those with, let's say, kidney, liver problems, or congestive heart failure. That's why some of these people need to take diuretics.
I see. Okay, so
Yeah,
diuretics is one thing that you need to balance that out. But is there a certain formula for hydration? How do you
yeah.
know that?
Usually, uh, from your body weight in ounces, like you need half of I mean, body weight in pounds, you need half of it in ounces, half of your water in ounces. So if you will, let's say, weigh 150 pounds, you need to drink at least 75 ounces of water, or at least 2 liters of water per day.
Okay, all right,
Yeah,
that was clear. So,
yeah.
yeah, thanks, though.
You're welcome. Oh, you can see me.
You're on mute, Anton.
Are you finished with the presentation,
Yeah, yeah. So
or
we're more on Q&A
will
now.
we're
Yeah.
doing Q&A? So, can you answer yung, di ba there was this news about COVID-related and hypertension, taking medicines. What's the story there?
Yeah, because the COVID virus works on a certain receptor in the cell. So those people who typically have high blood pressure and are taking certain medications are more prone to develop an infection to this COVID. Um, that's why you see it. People who are have a lot of comorbidities that actually succumb to the illness, whereas those who are young and who don't have any comorbidities, who have a stronger cell-mediated immunity, especially kids, don't get sick from this virus.
So, paano yun, Doc? You don't take the medicine?
Yeah, if a person right now, I would advise getting off of those medications and taking something more natural instead. Um, and zinc, by the way, besides being antiviral, also lowers your blood pressure. So it's a double. What do you call this? You get double benefits. Actually, more than that, because zinc is involved in like more than 300 processes, physiologic processes in the body.
So, just to be clear, Doc, baka lang ma-misinterpret. So, these are
Yeah.
medications specifically for hypertension na maintenance medicines. Ano ba
Yeah.
usually yun?
Pardon me?
What are these medicines usually?
You mean for high blood pressure?
High blood pressure.
Yeah, usually what doctors prescribe are diuretics, beta blockers, calcium channel blockers, ACE inhibitors. These are the typical medications given by doctors if a person has high blood pressure. It's great in controlling the blood pressure, but again, is sometimes people may develop a tolerance to this medication. So sometimes they end up taking 2 or more medications just to control the blood pressure. If you don't treat the underlying problem, the blood pressure could eventually go up. So it's really important to treat the underlying causes. And again, typically it's a dietary or lifestyle issue.
Okay. Ditto? May question.
So people who are actually overweight now, I think they have to take advantage of the quarantine and try to lose weight at home. Because as far as Dr. Joel was saying, no, the underlying cause is actually obesity. And one of the main reasons I actually changed my lifestyle is because of that. I was obese. And that has helped with my blood pressure moving forward. And then yun nga, yung mga underlying causes, no, just to name all of those that Dr. Joel said, no, and yung mga what do you call this, the supplementation. So Doc, yung potassium, magnesium, those other things, zinc is important, and then I think it has to be mentioned also vitamin D3. Tama ba, Doc?
D3, yes.
Yeah, D3 and vitamin C for your collagen and the hardening of the arteries. And then, Doc, I have a question, no, because I think pH has played a big part in helping my hypertension. So, does pH or keeping the body pH important and can actually prevent hypertension?
Yeah, the pH also affects your blood pressure. So normally, if you have acidic pH, you would tend to have a high blood pressure. So it's important to really pay attention to the food that you eat, because pro-inflammatory foods could actually cause an acidic pH, while anti-inflammatory diet consisting primarily of plant-based nutrition would actually help prevent hypertension.
Okay, thanks, Doc. That was very clear.
All right. So,
and by the way, potassium and magnesium are alkaline forming minerals. That's why those are the ones you find in your alkalate.
Okay.
So people who are hypertensive could actually take alkalate because of the potassium and magnesium in it.
Right.
Okay. Pero Doc, when they take this natural medicines or supplementation, can they do it together with their maintenance medicines, or what's the best way to transition, or pwede ba ipagsabayan?
Yeah, actually, if you're on medications, you have to be careful in just getting off of them, because some of them you need to taper off of the medications, Because if you do it, like say cold turkey, your blood pressure would shoot up. This is the advice we give for those who are on beta blockers. You have to taper off of the medication slowly, and then perhaps add the natural product to your program. Yeah, and a lot of medications, including those for hypertension, could actually deplete the body of certain nutrients. I think I presented it a few presentations ago, like how certain meds would actually deplete the body of certain nutrients. The most common nutrients depleted by medications include the B vitamins as well as CoQ10. Like, for instance, for high blood pressure medications, CoQ10 is depleted. That's why one of the most common side effects is fatigue for those who are on blood pressure meds.
Okay. We have a question from RC Luke. Hello. Is VCO safe for hypertension?
Yeah, I don't see any problem using VCO, but we don't typically use it for hypertension per se. But VCO is something that could be used for other issues, like for instance, people with thyroid problems, people with like problems with memory, people who are trying to lose weight as well. These are people who would typically respond well to VCO. And also, of course, it's being used against COVID. There's an ongoing study at Ateneo, I believe it's in Ateneo, and we had Dr. Dairit recently in one of our webinars. He's the lead scientist in this use of VCO against COVID.
What do you mean, Doc? Is parang to cure it or to fight against it?
Yeah, to fight against it using VCO.
Prevention, Doc.
Yeah, for
Prevention.
prevention, also for treatment. They're using it also for treatment. Yeah.
So like a prophylactic, Doc, tama ba?
Prophylactic, that's more for prevention. But again, it's also being used for treatment of those who are COVID positive, who may be asymptomatic, or for those with mild to moderate symptoms. It supposedly works for that. But of course, I would also recommend other things like zinc and quercetin, which I mentioned before, is an alternative to your anti-malarial drug, hydroxychloroquine.
So Doc, you mentioned olive oil, no? Olive oil. What was it again? Sorry for just to.
Yeah, it basically acts similar to an ACE inhibitor. That's a class of drugs that lowers blood pressure. So it's oleic acid, and it's derived from olive oil.
So okay. It has to be extra virgin, Doc. Extra virgin.
Yeah, best if it's extra virgin olive oil. Same thing with the coconut oil. It has to be virgin coconut, VCO, virgin coconut oil.
So Doc, how about avocado oil? Sorry.
It should be helpful because it's more of an anti-inflammatory oil.
Anton, you had a question. Sorry, I interrupted.
No, I think, guys, if you have questions, those watching in the live stream, you can join our discussion. Hindi, yun na lang. Kasi my mom has hypertension nga eh. So, pero nasa maintenance medicine. And, syempre, ayaw niya nang umalis doon sa maintenance medicine. Is it really hard to transition out of it? Or kung ang mindset of the older generation is, maintenance medicines and maintenance medicines na?
Yeah, it depends on the person and what their goals are. There are people who are really tired of taking prescription drugs, so they're willing to try natural medicine. But then there are those who are so used to it that they would just continue taking the medications because they're resistant to change. So if a person is like that, just pay more attention to possible side effects of the medications that they're taking. Because if it causes side effects, it could cause more problems.
Okay. We have more questions, Doc. From Vanessa. Is it safe to take ano to, NSAID medicine even if you're hypertensive? What's NSAID?
Yeah, these are anti-inflammatory medications. The thing is, if you're taking a lot of it, it could also cause renal or kidney damage, and that could also actually contribute to high blood pressure. Yeah, so I would recommend other ways to address pain or inflammation if you're taking high blood pressure medications. Things like omega-3 fatty acids could address inflammation or pain. Then other things like turmeric,
Enzyme.
also effective for inflammation or pain syndromes.
Okay.
Doc, how about enzymes for inflammation?
Yeah, proteolytic enzymes are also good for inflammation. You have to take these enzymes ideally on an empty stomach for it to work as an anti-inflammatory. Because if you take it with food, it would work as a digestive aid.
I see.
Mm,
Okay.
Yeah.
Doc,
okay.
how about a natural source for CoQ10?
I believe you could get it from more of meat products. That's CoQ10. Yeah.
And
Okay.
then, sorry, and how about a natural source of an nitric oxide?
Usually, you get nitric oxide from amino acids like L-arginine, which again is found mostly in meat products.
Okay, so I really
So
have to
paano
eat
yun,
meat.
Doc? So meron kang, you have to eat meat and you're saying plant-based. So hindi ba contradictory yun?
Yeah, actually, if you do eat meat, it has to be grass-fed or what do you call this? Free range.
No free range, no
Ah,
antibiotics,
Free
right,
range
Doc?
meat. Yeah, because again, when you eat like the regular meat, it's more pro-inflammatory because the way that these that they are fed would actually affect how they work on our bodies.
okay.
Like typically, regular meat is full of like antibiotics and hormones, and they also end up in our bodies causing problems with our physiology.
Okay. We have one more question, Doc. Apple cider vinegar. Does it help? Or walang effect?
Well, apple cider vinegar helps with a lot of like digestive symptoms. That's typically one of the reasons that we use them. But some people also use it to alkalize their system
Mm,
because of the alkaline forming minerals in the apple cider vinegar. Yeah,
okay.
apple cider vinegar has a lot of benefits, but again, most specifically, we use it as a digestive aid.
Okay. Guys, for people tuning in, if you have any questions, just put it in the chat in the chat below. Maybe Ditto, do you have question or you want to award the winner first, and then maybe some of the questions?
Yeah, so while we're waiting for people to send in their questions, maybe we can award it already.
Okay.
Anton,
Yeah. Maybe can you read it, Ditto? I'll share the ano.
you know what? I can't really see the.
Cannot see.
Wait, yeah, it's too small. I'm using my phone, so let me see if I
You
can read
cannot
it.
see.
Hold
Okay.
on, let me see. Okay.
Can you read it? Ako na lang.
Ikaw na lang, Anton. Sorry. Can't.
Okay, so for the winner of our glucose meter, we're giving away every show. So just email antondiaz@gmail.com. So there were a few people who sent the winner for today is Vanessa Villano. I believe you're watching, and she said, "Hope all is well. I would like to share with you the journey of my mom, who have been a diabetic patient for about 10 years now. At first, upon learning her condition, she's a bit anxious, worried, she lost a lot of weight, etc. To have the ForaCare GT40 glucometer for her to accurately monitor her sugar level. Maybe Dito, why is it accurate ba, the glucose GT40 meter?
Yeah, I think we already mentioned that during that last. I don't have my script now. I'm sorry about that. My TSMC was actually the one who has sent it and sponsored for this show, and it's he mentioned something about the accuracy, and I totally forgot. I'm sorry, Anton, but
Oh,
it's state of it's really good. It's a good glucometer, from what I know. Maybe next time we'll just explain it again.
okay. All right. So congratulations, Vanessa. We'll just email
Congratulations.
you
Yes.
directly. And if there's people watching in the replay or watching live tonight, you can just email us also if you. We love to hear stories, and we want to give away the glucose meter to those people who would really benefit from them. All right. Um, there's a question. Wait, there's a more question, Doc, before we close this. Sorry. All right. Can you see the question, Doc?
Yeah, yeah.
Ano
Yeah,
yung-
so hypothyroidism, yeah, it can cause an enlarged heart. As far as hypertension is concerned, good question. I don't think it could, but it could occur together, probably from different causes.
Okay. Next question. Coconut vinegar with apple cider vinegar? Okay lang?
I'm
Pareho.
not that familiar with coconut vinegar, so I can give my opinion on that. But I've used apple cider vinegar for a while now for my
Okay.
clients who have digestive issues primarily.
Okay. RC Look said hematocrit level. Ano yan dito? For you ba yan?
Yeah. So sorry. Okay. I found my notes about the glucometer. So the most important feature of the glucometer is the hematocrit range, 0 to 70%. This means that it can be used by a wide range of users. Different patient types have different hematocrit level, which affects glucose measurements in glucometers. So with the GD40's wide hematocrit range, you are sure that the measurement is accurate regardless of patient type.
Mm,
Hematocrit range is one of the considerations when choosing a good glucose meter. So I actually asked the people from TSMC for a care about the advantage of this glucometer. Kasi marami ako nakilala meters, yung mga glucometers na around, and I was just wondering yung advantages niya, and this is what they said about the hematocrit ranges, that it can affect the accuracy of the glucometer. And with the GD40, you're sure that even different patient types will get an accurate reading on it. So thank you TSMC for the notes.
okay. I think nasagot mo na Dr. Joel. Can hyper cause high blood pressure?
Yeah, hyperthyroidism can.
Okay. Can also.
Mhm.
All right. I guess those are all the questions. Maybe siguro for those watching in the replay, maybe you could also suggest what do you want us to cover in the next episodes. Maybe can we cover COVID related topic next time, Doc? Is that
Yeah, we
a
can.
topic that you
Yeah,
can
it's still,
discuss?
yeah, it's still a hot topic kasi. So we could do that.
Like the cure and prevention or ano bang
Yeah, we can discuss yeah, alternative treatments and uh, mga myths din.
and the myths.
Yeah,
Okay.
because yeah.
Yeah, very timely, and it's good na and there's actually a lot of studies nga, di ba? Or a
Mhm.
lot of discussion around this topic. So let's do that next week. Any other question dito before we close this or
I'm good. Thank you, Doc. Thank you very much.
Yeah, thank you guys.
Congratulations.
So
Thank you.
earlier, we had a lot of interruptions.
Okay naman. All right. That's it. Thank you. Can we have one? Can we have one photo lang before we close? Doc, pwede kang umakyat ng konti. Yan. Okay, 1, 2. All right. So
Okay.
thank you again, Dr. Joel Lopez. Thank you so
guys.
much. I learned
Thank
a lot on
Yeah, me too.
hypertension. Diba? Hindi pala siya disease talaga. It's a symptom and you can prevent it.
Yeah.
A lot of these causes are external. Anong tawag niya, Doc? Parang external living conditions, no?
Yeah.
Environmental and lifestyle.
And lifestyle. All right. Thank you. Thank you, guys. See you
you, guys.
next Tuesday, 7 p.m.
Same time.
Okay. Thank you.
Tuesdays with Dr. J.
Thank you.